This is Dr. Mercer, and I wanted to do a short audio presentation regarding eating disorders. When we talk about eating disorders, I think many times as clinicians we think more specifically about anorexia nervosa and bulimia. However, probably the most commonly coded based on the DSM codes would be eating disorder not otherwise specified. And we have to remember that not only thin patients that present to our office that we might readily suspected eating disorder could be anorexic or bulimic, but also patients of normal body weight, and even those that are obese can have eating disorders. So it's really important when we see patients to talk about what they consider their ideal body weight, to get the height, weight, BMI, and inquire on female patients about pre-pregnancy weight, and also what in all patients, what was their highest weight, what was their lowest weight. There are some associated health problems with anorexic patients that include bradycardia, orthostatic hypotension, hair dryness, cold intolerance, just generalized emaciation. Many times you'll see parotid enlargement, dental caries, mouth ulcers, or even calluses on the dorsum of the hands. It's important to inquire about body image, determine whether your patient has a low self-esteem. Are they particularly preoccupied with body image? Are they dissatisfied with the way their body appears or the way it's proportioned? And remember that compensatory behaviors include the use of laxatives and diuretics sometimes, and inquire about the patient's diet. You want to know what is the typical day for them. What do they eat? How many calories? Do they count the calories? Do they avoid certain food categories, those that are high in carbohydrates or high in fat? And also, don't forget to inquire about eating behaviors. Do they eat alone? Do they finish their meals quickly? Do they eat very slowly? Do they drink a lot of water in between meals to avoid eating? Those are all things that, as clinicians, we need to ask when we assess patients for eating disorders. And also remember that many times, probably most of the time, eating disorders are associated with other comorbid conditions such as a major depression, phobias, substance abuse, other addictive behaviors, and even social phobias and obsessive compulsive disorders seen with that. And suicide is more likely in those with bulimia. And that is all that I wanted to share with you all. I think most of it you'll probably cover in your reading, but I did want to make sure that you had that information. And that is it. Thank you.